Good morning, everyone. My name is Joanna Nemrava. I am a registered midwife working in Kamloops, British Columbia. I was invited here to talk about the role of the Canadian Association of Midwives. I'm a past president of that association, and I'm in good company. I have another past president here as well, so she can keep me in line. I'm really excited to be here. I've never been to Yukon before, and it's a beautiful, beautiful place. I've only got a few days, but I've been exploring, and it's an amazing spot to be in. Thank you very much for inviting me to be here. This is the national organization that representing midwives in the profession of midwifery across the country. We also work with the National Aboriginal Council of Midwives and support them as the voice of Aboriginal midwives. The mission of the Canadian Association of Midwives is to provide leadership and advocacy for midwifery throughout Canada as a profession that is autonomous, self-regulated, publicly funded, and a vital part of maternal and newborn care. We also promote the development of the profession in the public interest and contribute to the midwifery perspective on national health policy agendas. So CAM has been recognized as the professional body for midwifery in Canada since 2001. We support 13 provincial and territorial midwifery associations, as well as NACM. Currently in Canada, there's about 1,400, just over 1,400 practicing registered midwives. The majority of those are going to be located in Ontario, as well as British Columbia, Quebec, where midwifery has been established the longest in Canada. So across the country, the modern version of midwifery has been developed from the kind of mid-'80s into the early '90s when regulations first became implemented in Ontario and Alberta in the early '90s, and then followed shortly by British Columbia. And of course, the vision of CAM is that midwifery care is fundamental to maternal newborn care, that every family in Canada would have access to a midwife's care should they want it and be eligible. And we also play a role in global maternal and newborn health as well. So this graph shows our membership growth over the years. Oops. Oh, yeah. You can see that in 2007, there weren't very many midwives in Canada, about 720. And then to present day, when we're getting close to 1,600 now, those are just the more recent numbers, so more than doubled in the last few years. So I wanted to point out that CAM works together with the National Aboriginal Council of Midwives. And we support the autonomy of that association as representing Aboriginal midwives and Aboriginal women seeking midwifery care across Canada. NACM seeks to restore the access to midwifery education, access to midwifery services, and choice of birthplace in Aboriginal communities. They represent the professional development and practice needs of Aboriginal midwives. They meet with governments and health authorities to help make that happen. And there are currently Aboriginal practices, midwifery practices, in Ontario, Manitoba, Northwest Territories, Nunavut, and Nunavik in northern Quebec. So these are the most recent strategic directions developed by the Canadian Association of Midwives. You can see the association provides advocacy for midwifery as a profession that's publicly funded, autonomous, and self-regulating. We support the growth and development of the midwifery profession in all the provinces and territories. We support, of course, the Aboriginal midwifery through the National Aboriginal Council of Midwives. We advocate for practices that support normal birth and physiologic and birth, and keeping primary maternity care as close to home as possible. And of course, that means developing relationships as well with intercollaborative and interprofessional groups. That's a lot of communication and making sure that those teams are in place to bring maternity care, primary maternity care, close to home and keep that care available in rural communities when possible. And then globally, we are developing and strengthening partnerships to improve global reproductive health, maternal and newborn and child health. And the organizational capacity of CAM, of course, is one of our priorities. So we have a number of memberships. The Canadian Association of Midwives is one of the member associations of the International Confederation of Midwives. We hold 2 seats on that council. The International Confederation of Midwives represents 121 countries around the world. They developed actually core competencies for the profession of midwifery. It's one of the first international health bodies to develop a standardized definition of what the profession is and the core competencies that define that profession. The International Confederation of Midwives also publishes a quarterly journal called the Journal of Childbirth, I believe. Yeah. CAM as well is a founding member of the Canadian Network for Maternal, Newborn and Child Health. That network involves, I believe, about 60 associations, leaders from Canadian organizations that are involved in maternal and newborn and child health. And the goal of the network is, of course, to foster synergy and collaborative relationships between health organizations that are involved in maternal, newborn and child health, as well as providing advice to Global Affairs Canada. CAM also engages in interprofessional partnerships and discussions with a variety of other national healthcare organizations, the Society of Obstetricians and Gynecologists of Canada, the Canadian Association of Perinatal and Women's Health Nursing, the Canadian Nurses Association, College of Family Physicians of Canada, and the Society of Rural Physicians of Canada. One of the easy examples of a collaborative project, of course, was the 2012 joint position paper on rural maternity care. So the midwifery model of care in Canada is actually getting global recognition. It has some unique aspects and excellent outcomes in Canadian research. So registered midwives are autonomous health professionals. We provide primary care to women and their babies. And that's throughout pregnancy, so from conception all the way to birth, through the intrapartum care, and also in the early postpartum period. That varies from province to province and in the territories. So in some areas, midwives provide care 6 to 8 weeks after babies are born, and that's for the mom and the newborn. A lot of that care is often provided in home and community-based. And in some areas, that whole first year of the postpartum period is cared for by a midwife. Midwives are often the first point of entry to maternity care services and fully responsible for clinical decisions and management of care. So the model of service vary in details across the country, but there are some core values of midwifery that remain the same. That is continuity of care provider. It's well shown in the research that a familiar relationship between a woman and her healthcare provider makes a difference for health outcomes. Informed choice is also a basic tenet of midwifery care. That means collaborating with the woman and her partner as decision makers in their own healthcare decisions and choices, and also choice of birthplace, which includes across the country hospitals, birth centers, and home. Midwifery is growing. So this slide, and I'll take you a minute, give you a minute to look over it a little bit. But since regulations in the 1990s, when there were very few midwives across the country, probably about 500 total, and since that time, we've gotten to. This is based on 2013-2014 data, by the way. British Columbia being the highest, with midwives attending about 19% of births in that province. Ontario, 13.5%, and Nunavut, almost 15%. And then various numbers, around the rest of Canada. increasing quite quickly over the years as the number of midwives increases, of course, and the access to midwifery care improves. So Kathleen asked me to talk a little bit about pathways to education in midwifery, and that has grown too. So in the few years back, there were basically two options. You could be in Ontario, or you could be in BC. Now we have 7 universities across the country that provide a baccalaureate program in midwifery education. Those, I can tell you the names. We have education programs at McMaster University in Hamilton, Ontario, at Laurentian in Sudbury, and Ryerson in Toronto. Those are our Ontario programs. We have a program at the University of British Columbia, a university at Trois-Rivières in Quebec, and the University College of the North in Manitoba, and Mount Royal University in Calgary all offer 4-year baccalaureate degree programs. These programs are considered direct entry. It simply means that you do not need a prior degree in, for example, nursing, in order to enter one of these programs. There are also 3 community-based midwifery programs that are geared towards Aboriginal midwives and First Nation and Inuit communities. The Canadian midwifery education model is internationally recognized. It is unique from our southern neighbors in the US, where Dr. Jansen was alluding to the regulations are, and definitions of midwives are a bit more problematic. So in Canada, we have the luxury of a midwife is a midwife is a midwife. And the definition and the standards that a midwife is held to is regulated across the country as a standard. So a midwife in BC and a midwife in Ontario and a midwife in the Northwest Territories are going to be able to practice to the same scope and have access to and be required to have the same level of education and training. There are avenues for internationally educated midwives to practice in Canada, but they do need to meet a rigorous assessment process to make sure that they do meet the standards of a Canadian registered midwife, which we hold quite highly and dearly. So there are bridging programs currently 2, one in British Columbia and one in Ontario, that provide this assessment process and also provide an introduction for those midwives wishing to practice in Canada to the midwifery model of practice here and how it differs from other places around the world. So we have a lot of midwives across Canada who have come to us from, for example, the UK or Australia or other areas where midwifery has long been established, and a lot of these midwives have a great deal of experience. Or sometimes they're coming straight out of an education program from Dublin or one of the other very well-known education programs abroad. But sometimes they're also coming from another jurisdiction where we're not as confident that training meets our standards, and so that assessment process is very, very important. Midwifery regulation in Canada. I think one of our other speakers may be speaking to this, but just very briefly, each province and territory has a college of midwifery that is the regulatory authority responsible for establishing the standards of professional practice for all registered midwives practicing in that region, and also ensuring that the midwives are practicing to those standards. The Canadian Midwifery Regulators Council is a network that includes all of these regulatory authorities, and together with the Canadian Association of Midwives and as well as the Canadian Association of Midwifery Educators, these 3 professional bodies form the 3-pillar approach to midwifery regulation, education, and practice across Canada. So it's a very cohesive approach to making sure that anywhere that a midwife practices in Canada, that you can be assured that she meets the standard of care that is highly expected of her, and that there are processes in place. And this is, of course, what you'll be looking at here in the Yukon, processes in place whereby a midwife meets certain regulation standards and where there's a venue for making sure that that continues over time. And finally, one of the things that I'm also involved with on the board of the Canadian Association of Midwives is the planning for the International Congress that's coming to Canada in 2017. So the International Confederation of Midwives has a triennial Congress around the world. Back in 2014, it was in Prague, in the Czech Republic. It moves to a different location around the globe every 3 years, and we have the honor of hosting it in Toronto in 2017. We expect there to be close to 4,000 midwives from all over the world. In Prague, there was midwives from 200 different countries, and it's a really amazing event to be a part of. It's certainly an opportunity for Canada to showcase our unique model of midwifery care and the collaboration and success that we have experienced here with our model. If you have questions for the Canadian Association of Midwives, Tonya Okinero is our executive director, and she can be contacted easily with questions. And that's the end of my presentation.
Thank you, Jen.